Let us start with our today's topic from the periodontics is the normal periodontium. In that we have to study about the gingiva. Suppose this is the normal tooth structure and here is the gingiva present, the alveolar bone, normal tooth, alveolar bone, and this is the gingival margin. Here is the groove present. This groove is called as the marginal groove. Marginal groove. This groove is called as the free gingival groove. Free gingival groove. This is the gingival sulcus. Gingival sulcus. And here is the in between the gingival sulcus, the food debris are accumulated. Here's the enamel of the tooth. Here's the cemento enamel junction, and in this area mostly the junctional epithelium is present. This is the alveolar gingiva. Alveolar gingiva, and here is the mucogingival junction. From the free gingival groove till the mucogingival junction, there is a attached gingiva. Attached gingiva is present, and from the free gingival margin till the free gingival groove, there is a free gingiva. There is a presence of a free gingiva. Let us quickly revise the anatomy of this gingiva. This is the tooth surface. Here is the gingival sulcus. Here is the alveolar bone. Alveolar bone, gingival sulcus, junctional epithelium, enamel of the tooth. Here is the free gingival margin. There is a presence of a groove here. This groove is called as a free gingival groove. Gingival groove. Mucogingival junction. Here is the alveolar gingiva. Attached gingiva. Between the free gingival groove and the mucogingival junction, there is a presence of a attached gingiva. And here is the free gingiva. Between the free gingival margin and the free gingival groove, there is a free gingiva. And here is the cemento enamel junction. Cemento enamel junction. This free gingival groove is present in the 50% patients only. This is the first MCQ from this topic. Then about the attached gingiva. Attached gingiva is the firm and immovable one. Firm and immovable. It is attached to the connective tissue and underlying bone. Extend from the free gingival groove till the mucogingival junction. MCQ is asked about the width of the attached gingiva. Width of attached gingiva. So in the in maximum cases, in a maxillary central incisor, the width of the attached gingiva is the 3.5 to 4.5 mm. In the maxillary central incisor, in the mandibular central incisor, the width is the 3.3 to 3.9 mm. Minimum, it is minimum in the premolars. In the maxillary premolar, the width is the 1.9 mm, and in the mandibular premolar, the width is the 1.8 mm. So, if one scenario is given in the question that the following are the teeth having a less number of attached gingival width, so we have to mark as the maxillary premolar or the mandibular premolar, and the mandibular premolar in the minimum width, and in the maximum width we have to mark the central incisors of the both maxillary and as well as a mandibular one. The width of the attached gingiva is increases up till the 4 years of age, and also it increases in the supra eruption of teeth. The width of attached gingiva is increased in the 4 years of age, up till 4 years of age, as well as increase in the supra eruptive tooth. If in MCQ they were asked about the minimum width of attached gingiva, then we have to mark it as a 1 mm. It's the minimum width of attached gingiva. Less than 1 mm is present, then it causes the inflammation as well as the recession. If in MCQ they were asked about the following entities of the gingiva is constant throughout the life, then we have to mark the mucogingival junction, which is constant throughout the life. It is a junction between the attached gingiva and the alveolar gingiva, that is mucogingival junction, and it is constant throughout the life. In attached gingiva, it is increases width increases up to the 4 years, and in the supra eruptive cases, and minimum it is the 1. If less than 1, then there is a recession case or a inflammatory case. The marginal gingiva is present here. So the if they ask about the width of the keratinized gingiva, then it is the 2 mm. Which is the keratinized gingiva? Attached gingiva and the marginal gingiva. Attached gingiva and the marginal gingiva is the keratinized gingiva, and the keratinized gingiva having a width of a 2 mm. Next is the biotype. What is a biotype? It is a thickness of a gingiva. It is a biotype. The thickness of gingiva is measured by the color U probe. Color U probe. There are three types of color of the probe is present. There is a white type, blue type, as well as the green type. White, green, and blue. Using the white probe, first insert it in the gingival sulcus. If there is a tooth, this is the tooth, central incisor, upper central incisor. So the probe is inserted here in the gingival sulcus. Here is a marking of a probe, that is a white probe. The white probe first insert it in the gingival sulcus with the pressure. If the marking is visible, can see the color through the gingival tissue. Then biotype is the thin. If the color is thin, then biotype is thin. Then other green probe is inserted into the gingival sulcus here. If a white is not visible, use the green probe. In the same manner, if the color is visible through the green, then it is a medium one. If white color is seen, then it is a thin biotype. If green color is seen, then it is a medium. And blue color is seen, then it is a severe or a thick. Then very thick means the blue color is not visible, then it is a very thick biotype. Let us discuss about the gingival sulcus. This is the gingival sulcus. It is a shallow V-shaped space surrounding the tooth. Shallow V-shaped space surrounding the tooth, and this probing force to check the sulcus depth is the 25 gram is the probing force to check the gingival sulcus. Probing force to check the gingival sulcus is the 25 gram. Probing force for the transgingival probing. For the transgingival probing is the 50 gram. They were asked about the these two types of MCQ, that the probing force related to check the gingival sulcus, the answer should be 25 gram, and the probing force for the transgingival probing is the 50 gram. Um, so what is the transgingival probing? It is the probing till the alveolar crest. We have to probe till the alveolar crest forcefully. First of all, we have to give the LA to this tooth, and we are forcefully inserted the probe, and up till the alveolar crest is filled. So this type of probing is the transgingival probing, and force required for the transgingival probing is the 50 gram force. How much is the probing depth? Probing depth is the 2 to 3 mm, and histologic depth is the 1.8 mm. Under the microscope, the histological sectioning is done, and the histological probing is the 1.8 mm. What is interdental gingiva? Let us suppose this is the central incisor, upper central incisor. This is the lateral central incisors. So the interdentally gingiva is present. This gingiva is called as a interdental gingiva, and in the anterior teeth it is like a pyramidal shape, and in the posterior teeth it is a in posterior teeth it is a tent shape or cone shaped. So what is a cone? Cone, it is a interproximal area. It is a non keratinized. The MCQ is asked about the cone. What is cone? Cone basically is the interdental area, and it is a non keratinized one. It is a highly colonized by the bacteria. This cone is highly colonized by the bacteria. Let us learn about the microscopic features of the gingiva. So, microscopically, gingiva is divided into epithelium, that is outer oral epithelium, then cellular epithelium, and junctional epithelium. So this epithelium we have to discuss in the another lecture. Stay tuned. Happy studying.